Clinologics, Vishakhapatnam. Following her training, she served as a physician assistant and duty medical officer at RK Hospital. Subsequently, she joined Harshita Hospital as a duty medical officer and then as clinical pharmacist, where she is continuing her work for various departments. She has also acquired several certifications in various courses like Emergency Medicine Core Content Course, Focused Assessment Sonography in Trauma, Basic Life Support, and many other courses. We welcome you, ma'am, and we are looking forward for today's session.
Thank you, Shivani. It was a nice intro. Hello, all. Hope you all are doing good. Today, I'm here to talk about an exciting and dynamic field in healthcare, the role of clinical pharmacist in acute and emergency care. So, you may all think why it was very important for us. So, let me assure it will you'll get it under the presentation. So, what was our role in as a clinical pharmacist in emergency medicine? So let's begin with the picture that see when a patient comes to a in an emergency medical situation. Is it visible now? Yes. So let's begin with a picture that what happens in the emergency medical situation. So let's imagine a patient who comes with the gasping of breath. So all the medical experts and medical team has been quickly resolve the patient and associated with the treatment plan. But what was our role in this patient? So you should say that what the medication has been ensuring was appropriate. Is it very necessary for the patient? Is the dose was appropriate to the patient or not? Is it effective to the patient or not? So that is where clinical pharmacist as we come in our role by optimizing the patient outcome in healthcare efficiencies so that we can save their lives. So I will basically I'm giving you the sample few requirements of what the emergency clinical pharmacist need. ACLS and PALS course, which means life support courses like advanced cardiac life support and pediatric advanced life support. The people who has advanced trauma life support pharmacist role in emergency care. So we also must know about the pharmacology of the drugs used in this, like airway management, like neuromuscular blocking agents like succinylcholine, rectorium, and the drugs used in intubation program like inducing agents like etomidate, and the sedation agents like fentanyl, midas, and ambulatory care where we can use analgesics, NSAIDs, and antiemetics, and cardiology where we can use ACE inhibitors, and general medicine and infectious where we use antibiotics, and the pediatric doses may vary accordingly. So procedural sedation means the we have some guidelines for sedation the aggregated patients. So we should also learn what the drugs were useful and what dose the patient may require. This is where the clinical pharmacist comes very important for the patient in this. And toxicology, like drug overdose, like we use pam paradoxim in a organophosphate poisoning and naloxone in opioid poisoning and so on. So what is this? What were our roles in this? So the emergency patient pharmacist was including the pharmacokinetic and therapeutic consultation. We must collaboratively work with all the healthcare physicians around your hospitals. And I agree, is the guidelines will be different from we can do. We can monitor closely with the healthcare team, providing the crucial input on the medication of what they are selecting medications to what patient, the doses and monitoring. In acute and emergency settings, it will be a essence that clinical pharmacists to make a rapid decisions as it was an emergency care. We must do the procedure very rapidly as time will be very vital in these patients. So we must take the drug history, drug interactions, and the allergies the patient have, and we should ensure that the right medication is administered promptly. So you might be thinking it was the job of doctors and nurses. No, why we are used to that? So I was telling as we were learn more about the pharmacology of the drugs, it will be unique expertise that we should do all these things. We have in-depth knowledge in the drugs, including the mechanism of action, side effects, and interactions. So this college allows us to specify and do the medication errors and drug interactions and drug allergies according to the medications which the patient were using. So let's what we can also do, we can interact with our juniors or the other students who are doing the clinical research products too, often involved in the patient education and counseling the patients about the regimen of the patient and potential side effects included and the proper administration techniques. This not only improves the patient adherence but also empowers the individuals to take an active role in their own healthcare. So, how does it impact as aspiring healthcare professionals? So I am getting to that. As a healthcare system become more complex nowadays and patient centered, the demand of clinical pharmacists and acute and emergency care has been improved. So by understanding this role, we can collaborate effectively with the doctors and other staff who along with the patients for the complement. So can we can avoid the medication errors, contraindications, and we can really save a life for the patient. So coming to that, I'll briefly say about some drug interactions which may be useful for you at the end of this. So, what was the clinical pharmacist role in the acute medicine? So, in acute medication therapy means we can provide drug information to the healthcare providers along with the patients and monitor closely is the drug was evolving to the patient, is the drug was good enough to the patient, will the symptom reside or will the symptom substitute or much more. So these interventions can lead the patient hospital stays and lower the healthcare cost. In emergency medications, we identify the drug interactions and optimize the medication therapy for critically ill patients. So I am saying you some of the drug interactions like NSAID and warfarin, where it can increase the risk of bleeding. So according to this drug disease related, I am saying now, for instance, beta blockers used to manage the hypertension. So it can also exacerbate the asthma symptoms in this patient. So you should see that is the patient has any disease along with this, is the patient was suitable for this drug or not. So we can also see the contraindications of what we can use. See, for example, for the pregnant woman, we shouldn't prescribe tetracyclines as it may be potential harm to the developing fetus. So we must easily and substitutingly use this knowledge in the emergency medical care settings and reduce the risk of adverse side effects patient to their lives. And in renal and hepatic impairment patient, the dose adjustment are must. As you may all know, the dose adjustment in the renal and hepatic patients, we must and should we should do the dose adjustments. And coming to the interactions like pharmacokinetics, you should know about the metabolism of the drugs and what the distribution, how much the half life of the drug, how much time it takes to go in the body, and how much time it used to do this all, and optimizing doses so that we can minimize our side effects. And coming to this, we can you also used in the. Am I going little bit speed, or is it okay for you all guys? Can anyone reply? Yeah, yeah, yeah. Okay, I will just make. I'll make it so. Yeah. Coming to the overdose and toxicity, we can also use what is dizziness, what is the respiratory depression for what drug, what overdose we may cause. So this was all the clinical pharmacist things to do and to do the patients. So for by identifying and managing these drug interactions, contraindications, and all the allergic reactions for the patient, we may play the patient safety in acute and medical care. So, what was the benefits of clinical pharmacy service? Coming to this, we can reduce the healthcare cost by ensuring the medication safety and thus reduce the adverse drug reactions. So, by this, we can reduce the patient hospitalization and doesn't promote the readmissions of the patient. So, what the challenges we can implement this? As the hospital may lack of resources and lack of awareness and many don't know about the drug interactions for what way they cause, we mainly should take the initiative for the doctors or the healthcare professional to say what drugs causes what, and they may blindly, I'm not saying I'm against the doctors, but we must also ensure that the collaboration was very important in this. However, clinical pharmacy services may be little bit tough in India according to other states. I agree with this. So we can get into the conclusion. So I am telling you about the case which I personally into it. So once a patient came to the emergency department with the shortness of breath and the severe chest pain, and he also had the irregular heartbeats. So as I think I had took his medication history, like what he was using. So I had got to know he was recently prescribed the Warfarin, and for his leg pain he was using a non-prescription medications like NSAIDs. So here we can correlate the things as warfarin and NSAID causes the risk of bleeding, which may induce this patient as SOB and leads to the chest pain. So we should collaborate with the cardiologist team and the doctor's team and ensure the patient what he was using so that we can promptly help to stabilize its conditions. So this intervention and medication management will expertise and reduce the patient risk of the cardiac emergencies. Okay, thank you. Is there any doubts in this? I have been little fast, I think so. Do you have any doubts? Yes.
No, sir, there are no specific queries. The session was quite good and understandable.
Thank you, Adik.